Hi, everyone. We're going to wait till 4:01 to get officially started. Thank you for joining. Great. Well, we have a good group of people. Thanks for joining. Let's go ahead and get started. So my name is Rajiv Ramchand, and along with my colleague, Carrie Farmer, I co-direct the Rand Epstein Family Veterans Policy Research Institute, and I want to welcome you to this webinar today. This is part of our bi-monthly webinar series, focus on high-priority veterans policy issues. Our Veterans Policy Institute has as its mission to conduct innovative interdisciplinary research to improve the lives of those who have served in the U.S. military. We aim to publish and widely disseminate our research findings to connect objective, rigorous analysis to decision makers so that we can improve evidence-based decision making. A couple of quick housekeeping items before we get started. We have the chat feature open, so please feel free to ask questions and share resources that our audience may be interested in. To ask questions to the panelists, please use the Q&A feature. We'll monitor that and try to get to as many questions as we can. Today, and especially in commemoration of LGBTQ plus Healthcare Awareness Week, I'm pleased to introduce my colleague, Megan Schuler. Megan will be presenting new research from the Institute that the Institute is publishing next month on the health of veterans who identify as lesbian, gay, bisexual, and/or transgender, how these outcomes vary by the states in which they live, and how state policies specific to LGBTQ plus individuals may be affecting these outcomes. Megan's presentation will be followed by a panel discussion with our guest experts, Allison Jaslow, Eric Golnick, and Ian Michael. We're thrilled to welcome back our Rand colleague, Kayla Williams, to moderate this discussion. A little bit about Megan. She's an applied statistician at Rand, and her primary research centers on substance use and mental health disorders. Methodologically, as a statistician, she develops and applies causal inference methods that facilitate rigorous analysis of observational health data that she'll share with us today. And with that, I'll turn it over to Megan.
Thanks so much, Rajiv. Thanks so much, Rajiv. Can you hear me?
We can.
Okay, perfect. Thanks. So I am.
Megan, we can't hear you.
You can or can't? Can. I see thumbs up. Many thumbs up. Okay, sorry. Okay, so I am delighted to have this opportunity to share some findings from our forthcoming Rand report. And I want to acknowledge my co-authors on this work, Josh Breslow and Beth Roth. So to start off with, the VA and community providers who are working to serve LGBTQ plus veterans face some headwinds, both in terms of health inequities among LGBTQ plus veterans and potentially restrictive laws and policies at both the state and federal level that may complicate service provision. So the Biden administration has specifically identified improving services and outcomes for LGBTQ plus vets as an administration priority. And as VA and DoD policies evolve, they are being enacted across states that have very diverse state policy climates, particularly when it comes to LGBTQ plus related policies, which, as we know, have been particularly dynamic and divergent in very recent years. So the motivation for the work I'm presenting is twofold. So first, we wanted to comprehensively examine health outcomes in a large national sample of both sexual minority and transgender veterans, given evidence that LGBTQ plus veterans, as well as civilians, experience health disparities relative to their non-LGBTQ plus peers. So we use data from the CDC's Behavioral Risk Factor Surveillance System, which is an annual national telephone survey of US adults. And since veterans, and particularly LGBTQ plus veterans, represent a small proportion of the general population, we pooled data from multiple years in this analysis to get a sample with approximately 6,400 sexual minority veterans and approximately 1,000 transgender veterans. So our first objective was to generate nationally representative prevalence estimates of health outcomes across 3 domains. And as you'll, so the domains of interest were healthcare access, listed here, and affordability, current health and substance use, and chronic conditions. And as you'll see in the figures I show, we compared veterans who identified as gay, lesbian, bisexual, or another identity to heterosexual veterans. And we also compared transgender veterans to cisgender veterans. And then our second motivation for this work was to understand how state policy climate regarding LGBTQ plus related laws may impact LGBTQ plus health. So focusing on just LGBTQ plus veterans, we wanted to see if state policy climates that were more favorable towards LGBTQ plus veterans were associated with better health outcomes for LGBTQ plus vets. So in terms of ranking state policy climate, as shown on this map here, the nonprofit Movement Advancement Project tracks state policies that may impact LGBTQ plus individuals, either favorably, such as laws banning discrimination based on sexual identity or gender identity, or negatively, such as recently proposed Don't Say Gay laws or laws that limit access to gender-affirming care. So this map shows their current classification of states, with states in orange and red having more negative, less supportive climates for LGBTQ plus folks, and those in green and blue having more supportive climates. So now I'm going to walk through findings from just a few of the outcomes we looked at. Next. So for starters, we looked at what percentage of veterans did not have health insurance. On the left of this figure, we have results broken out by sexual identity for both female veterans in green and male veterans in blue. And on the right, we're comparing cisgender and transgender veterans. I'll note that all prevalences I show today are age adjusted to account for the fact that LGBTQ plus veterans tend to be much younger than non-LGBTQ plus veterans. So as shown here, we found that across the board, LGBTQ plus vets reported higher rates of uninsurance, and that these differences were statistically significant for bisexual vets. So in particular, rates of uninsurance were nearly 10 percentage points higher for bisexual female vets compared to heterosexual female vets. Next. We looked at whether state policy climate mattered and found that indeed it did. So among LGBTQ plus veterans, those living in states with more favorable policy climates were significantly more likely to have health insurance. So to orient you to this figure, we're plotting the relative likelihood or odds ratio of having insurance compared to those living in the negative climate states, which is our reference group, which gets a reference value of 1 on the left-hand side. So LGBTQ plus vets in low and medium climate states, which are more favorable than negative, had approximately 3 times the odds of having health insurance compared to those in negative climate states, after adjusting for some other demographic characteristics like age, sex, and race ethnicity. And LGBTQ plus vets in the most favorable climate states had nearly 5 times the odds of having insurance. So these are pretty sizable differences. In terms of interpretation, some of these differences may be due to the anti-LGBTQ policies themselves. So for example, LGBTQ plus vets living in states without anti-discrimination laws may have more negative or precarious housing and employment situations, and thus may be less likely to afford health insurance. But these differences aren't necessarily due only to LGBTQ plus related policies themselves. So for example, many of the states with negative policy climates did not participate in Medicaid expansion, which likely also contributes to higher rates of uninsurance. Next. We also looked at poor mental health, which was defined as rating mental health as poor for at least 2 weeks in the past month. Across the board, we saw that sexual minority and transgender vets reported much higher rates of poor mental health than their heterosexual and cisgender peers, with rates nearly twice as high for bisexual veterans, those with other identities, and transgender veterans. Next. Then we looked at whether poor mental health was associated with state policy climate. So here to orient you, policy climates that are associated with decreasing the likelihood of poor mental health are reflected as odds ratios less than 1. So we see that estimates for low, medium, and high climate states are less than 1 in the expected direction, but only statistically significant for low climate states. So we see a trend towards better mental health, but not consistently significant associations between policy climate and current mental health. Next. Looking at the rates of current cigarette smoking, we find that gay and lesbian veterans had significantly higher rates of smoking than heterosexual veterans, and transgender veterans had higher smoking rates than cisgender veterans. Again, quite sizable differences here. Rates of smoking were nearly twice as high for lesbian veterans compared to heterosexual female veterans. Next. Looking at associations with state policy climate, we find that LGBTQ plus veterans in states with more supportive policies were significantly less likely to smoke than LGBTQ plus veterans living in states with the least supportive climates. So smoking is often used as a stress relieving coping strategy. So one possibility is more supportive states could mean fewer stressors experienced by LGBTQ plus individuals. So there's less smoking to cope. Next. In terms of chronic conditions, one outcome we examined was lifetime heart attack. So as you can see, the proportion of those reporting ever having had a heart attack were significantly higher for bisexual vets and those with other identities compared to heterosexual veterans, and were much higher for transgender veterans compared to cisgender veterans. Next. In terms of state policy climate, we did not find that lifetime risk of heart attack was significantly associated with policy climate in the low, medium, or high climate states. Next. The report details results for many more outcomes, many more chronic condition outcomes, and just wanted to highlight here the other types of chronic conditions that we looked at. And note that we found that LGBTQ plus veterans experienced significant disparities on many of these outcomes. But for the most part, state policy climate was not significantly associated with the lifetime risk of these conditions. Next. So in conclusion, using a large national sample of both sexual minority and transgender veterans, we documented that LGBTQ plus veterans are experiencing inequities regarding healthcare access and affordability, current health, substance use, and chronic conditions. When we looked at the potential role of LGBTQ plus state policy climate, we found some preliminary evidence that policy climate may contribute to the magnitude of these disparities for some health outcomes, such as health insurance status, smoking, and mental health. And overall, ongoing efforts potentially that are adaptive and reactive to changing state policy climates are needed to eliminate these disparities in access and outcomes. Thank you.
Well, thank you so much for that presentation, Megan. It was a really helpful introduction to ground and inform the discussion that we are moving into now. Everyone, please join me in welcoming our guest panelists: Army veteran Allison Jaslow, CEO of IVA, Navy veteran Eric Golnick, Executive Vice President, co-founder and CEO of Forge Health, and Marine Corps veteran Ian Michael, LGBTQ+ veteran coordinator for the state of Oregon. And thank you all so much for joining us today. I also love that you're being interactive and using those React functions so that I know that people are actually out there and I'm not just talking into my screen alone. All of our panelists, thanks so much for joining us. You have diverse and impressive bios that our audience can read in full on the webpage about this event. I'm confident that your unique areas of expertise will contribute to a really rich discussion about how state and federal laws and policies may affect health outcomes for veterans around the country, and what organizations are doing to support LGBTQ+ veterans and their families. I'm Kayla Williams, a senior policy researcher here at RAND. My pronouns are she, her, and I'm honored to moderate this important conversation. On a personal note, I can still vividly remember the first time I read about health disparities for sexual and gender minorities, because I was struck by how many of the poorer outcomes for bisexual women were true for me. I have since quit smoking and tried to find healthier mechanisms to cope with stress and reduce risk factors. But of course, my choices are only one element of the complicated set of interrelated factors that are going to influence my long-term health outcomes. Another important component may be minority stress, in which discrimination, prejudice, and social stigma can harm mental and physical health. And as Megan shared, state-level policies are another thread in that tapestry, one that we're going to delve into more deeply today. Audience members, I think that we're having a problem with the Q&A feature, but we're trying to get that turned back on. I'll give you an update if I find out about that. We will turn to those questions later in the discussion. If that doesn't work, you can use the chat and I will monitor that. So I want this to also be conversational, so I'm going to urge panelists to jump in on questions, even if I target it to others, if you have something to add. Megan, to kick us off, I'd like to turn it back to you briefly. Was there anything that surprised you about the findings in your study? And also, what follow-on research would you prioritize based on what you've already seen?
Yeah, thanks. So I guess two things. First, the magnitude of some of the disparities we saw around insurance status and affordability of care surprised me. And I was also surprised by the consistent disparities we saw across a pretty diverse set of chronic conditions. So some of those could be related to other disparities, such as elevated rates of smoking and binge drinking among LGBTQ+ vets, but may also basically reflect long-term wear on the body from LGBTQ-related social stressors and discrimination. And some LGBTQ+ vets presumably had lower engagement with the healthcare system because they found it discriminatory or unaffordable, and thus missed out on preventative services and early screenings that could have helped curb chronic diseases. So in terms of next steps, I think it's really important to track trends over time as new survey data comes out and state policies evolve, and also to dig into understanding the whys of how state policies are actually impacting these outcomes. Thanks.
Thank you so much. That's really helpful. Allison, I'm going to kick it to you first. I mean, some of these disparities that we've been talking about, we know can more broadly affect LGBTQ+ individuals, but we're here to talk about LGBTQ+ veterans. So can you start off by talking a little bit about how Don't Ask, Don't Tell and previous anti-LGBTQ+ and military policies affected service members and veterans, and what you think is important for us to consider doing from a restorative justice perspective? Can you also come off mute to do that?
Thank you for reminding me to come off mute, Kayla. I think the first piece of perspective I'd offer as it relates to Don't Ask, Don't Tell is like, it is very much an experience that is different based on each individual. I think it depends on whether whether your life was devastated because you were outed and got kicked out with a less than honorable discharge, whether you had to suffer in silence at a certain point in your career with your sexuality, and maybe you weren't in a relationship or weren't trying to follow it, but you just couldn't live in full integrity. I think you and I are both, veterans of war, Kayla, and there are people who are probably in relationships who kept them under wraps, but couldn't, their spouse, when they were gone, couldn't be a part of an FRG. And then the story I tell about my lived experience, because I identify as gay, is when I was 13 is when I decided that I wanted to be in the Army. And back then it was my dream. Like I thought I was going to do it for my entire career. And, I went to college on an ROTC scholarship, and you signed some paperwork that I joke, we call it don't ask, don't tell. I joke that it reads in the policy as don't you dare. But, as an 18-year-old in college, when many people start to awaken to their sexuality, I mean, it might be a little different for kids these days. Like, I didn't really start to realize that I was gay until almost the end of my military service. And part of me wonders, and I'll never know this, because everybody's journey is different to, understanding their own sexuality. But like, I almost feel like I didn't have incentive to give myself permission to even go there, because it would have essentially just like vanished my dreams, right? If I wanted to be an Army officer for a career, if I wanted to be the first woman 4-star at that time, because when I was, originally in ROTC, there wasn't a woman 4-star. And so I think there's ways that like, don't ask, don't tell impacted lives that we still don't even have a full understanding of at this point. But from a restorative justice perspective, I just feel like we should have a guilty conscience as a country, and something where IAVA will try and make an impact, at least under my leadership, is like for the people who got kicked out, like some people's entire, like who wants to go into an employer and say, I just got out of the Army, and they're like, oh, were you honorably discharged, and have to say, no, I wasn't. Does that really like lend itself to successful civilian employment? And there's, there's people who should have earned benefits, who lost benefits, who need those benefits again. And there's a lot of work to be done for the people who got kicked out. And unfortunately, it's a very complex problem, because not everybody who got kicked out for homosexuality either. So it's something that I think I would say, sort of in closing without running on anymore, I think as a nation, we need to recommit ourselves to righting this wrong. Like, the world has changed. We were wrong in the past. We need to do everything within our power to fix it. And like, we shouldn't be having to fight institutional forces to get there. The Pentagon is not really motivated to solve this problem, unfortunately, and it's a travesty. We're going to continue to try and do our part to sort of push the people who have the power to fix this. But it's going to take some serious collective effort. And unfortunately, at the end of the day, there are some people who I think will never get justice, because maybe they're in a straight relationship now, but got caught in a homosexual relationship when they were in the military. And so it's just the secret that they're going to carry with them for the rest of their lives. And that's probably the saddest part about the work that we do to try and restore justice here, is that there are some people who will suffer in silence indefinitely because of this. But
Thank you so much.
We'll keep at it. Yeah.
It's really important element, and I appreciate you really grounding us in that humanity and the pain that a lot of people have endured because of it. Eric, I want to turn over to you. Forge Health, you've told me, has locations in multiple states, including some that show up as less supportive on the map that Megan shared. Can you talk a little bit about what services your organization provides and why it's important to those that you serve?
Yeah, absolutely. And thank you, by the way, to Megan for this report. This is incredible and much needed, really to the point where we really don't have a lot of visibility into this, and a lot of government agencies don't have a lot of visibility into this. So thank you for doing that. So Forge Health, we provide mental health and substance use treatment to veterans, first responders and their families. And we're all on the outpatient level. So we're very community based. So it is, we see veterans all across the states we're in. And I would say, one of the things that we see on the ground level is the disparity also, not just in the states that are considered less favorable, right? But also in rural areas of the states that are favorable, because there are some rural areas that we see I can give you an example in Western Pennsylvania, locations out there that people don't feel really safe. And to go to Allison's point, right, about don't ask, don't tell. I served under don't ask, don't tell as well. I identify as gay as well. And there's a lot of distrust for a lot of these institutions, and there's distrust to talk about from a mental health perspective, a lot of these issues. So, you know, from what we see it in our less favorable states. We obviously see it more prevalent where people are much more less inclined to get help, right? So they're fighting the mental health stigma, and as well as fighting the stigma of having served under don't ask, don't tell, or having to have, you know, kept that together. What we really push in on, and I think is important for not just us, but everybody across the healthcare spectrum, is that cultural competence piece, right? Is having a place where you can have cultural competence, LGBTQ plus cultural competence, where you're able to address issues and be able to like create a safe environment for people to be able to talk through and actually work through that trauma without feeling like they're not, you know, they're going to be discriminated against.
Thanks. That's really helpful. I appreciate it. Also, I do want to note, it looks like the Q&A feature is working, so folks feel free to use that. And if you have used the chat already, I will get to your question when we get to that section. So I'm excited to have audience participation as we move forward as well. Ian, not all states have a role like yours, right? I think Oregon is one of the states that was identified as most supportive on that map. And can you tell us a little bit about how your position helps improve healthcare access and outcomes for LGBTQ plus veterans in Oregon?
Yes, absolutely. And thank you for the question. And just for the audience members, so again, I also served during the period of Don't Ask, Don't Tell, the United States Marine Corps. Again, my name's Ian Michael, and I use he, they pronouns. And Megan, to answer your question, you know, as the LGBTQ plus veteran coordinator and special advocate for the Oregon Department of Veterans Affairs, I play a crucial role in enhancing healthcare access and outcomes for the LGBTQ plus veterans here in our state. In the landscape of veteran support, you know, as you had mentioned, Oregon stands out as one of the most supportive states, you know, when you identified that with the map. And thanks to our Senate Bill 946, I'm the second to hold this pioneering position, which is solely focused on addressing the distinct needs of the LGBTQ plus veteran community here, while also ensuring that we're creating a safe space for this underserved community. As many of you have already addressed, you know, there's a lot of work to still be had for advocating and serving the LGBTQ plus community. My duties here in the state of Oregon encompass a wide range of activities, from conducting outreach, education, creating presentations, to facilitating LGBTQ plus veterans and those who served in accessing their federal, state, and local benefits. I also advocate for policy development and transparency by ensuring accountability through regular reporting to our legislative assembly. As I had mentioned, you know, my position specifically was enacted by our legislation. And in practical terms, I provide personalized assistance to our LGBTQ plus folks. And I say that because not all individuals who served identify as veterans. And so, you know, it's been very important for us to ask, you know, did you serve in the military, to really identify the LGBTQ plus service members and veterans. I work to guide them through the complex processes, and this includes state or federal healthcare enrollment. I also assist our folks with name and gender changes, and this may happen within the VA or maybe simply helping them get to a courthouse in order to start that process. I work to also ensure that LGBTQ plus veterans here in the state have access to housing, and this could be, again, VA and non-VA. But I think the crux of my job here is also assisting LGBTQ plus folks who served during Don't Ask, Don't Tell and prior with their discharge upgrades, with BCMRs, but also with the character of service determinations that are required in order for individuals to access their VA benefits. I work on our appeals and special advocacy division, so I love when VA says no. That is where I jump in. I love appeals. But really, by advocating, educating, and offering direct services, the goal here is to cultivate an inclusive environment where LGBTQ plus veterans feel safe, seen, empowered, but also valued. And this approach allows me to tackle discrimination and barriers to care. And this includes the remnants of policies like Don't Ask, Don't Tell. And it really allows me also to foster a greater understanding within the realm of veteran benefits, access to benefits, but also showing the LGBTQ plus folks that serve that they earned their benefits, they're entitled to their benefits, and I am a liaison to ensure that they get their benefits. And before I end with this question, I also want to highlight that I can't do this job alone. I also collaborate closely with ODVA's coordinators, specializing in veteran houselessness, campus outreach, women veterans, tribal veterans, and our incarcerated veterans, our aging veterans. And this collaborative effort allows and ensures that I'm constantly and consistently addressing and assisting individuals who may have intersecting identities. And this allows me to effectively meet them where they're at and meet them meeting their unique needs and challenges. So ultimately, my role is about making tangible improvements in physical health, mental health, quality of life, functional abilities, and overall well-being in the lives of those who serve during these difficult, challenging times. And I really pride myself in equipping LGBTQ plus folks in the state and abroad with the knowledge and support to, again, assert their rights and access the benefits that they earned. And sadly, sometimes these efforts and support are I always mess this word up, posthumously, because yes, in this state, we were successful in ensuring that an individual discharged prior to Don't Ask, Don't Tell that sadly passed away. We ensured that their discharge was overturned, and they are currently resting in a national cemetery as a veteran. Thank you.
Thank you so much, Ian. That's really helpful. And I appreciate you pointing out the importance of working across a lot of what some people maybe call business lines, right? And being able to think about how many of us occupy different spaces. Another thing that this has made me think about is, my previous research has found that LGBTQ plus veterans, along with women veterans, don't always feel welcome or accepted in all VA facilities or in all veteran serving organizations. So not every organization can afford to hire somebody with your specific job. So I'm curious if folks have ideas, and anybody can, come off mute and jump in to share your thoughts. What are some tangible steps, short of hiring an Ian for yourself, can take to make facilities and or events more welcoming to LGBTQ plus veterans?
I'd like to hop in, and I see Eric's also, because I think Eric highlighted it. Cultural competency really is key. There's a lot. I'm constantly creating education presentations, and even as a service member who served during these periods, I couldn't act as though I knew everything. And so I spent the first 6 months diving into Smithsonian records, really trying to highlight the strength and resilience of this community all the way back from from the Band of Thieves, but really going back to George Washington and working our way up, because when we understand our impact in this community, but also our impact in our national security, what we start to realize is we can start to see beyond the acronym, and we'll find the human on the other side, and we'll really be able to find that a safe space to provide that tailored support. But Eric, I saw you unmuted too.
No, I don't know how I follow that, Ian. I mean, that's incredible. No, I would say, and this is not to beat up on the VA at all. This is just something that I've observed as we're kind of working through some of this stuff. The cultural competence goes beyond the clinical work, right? It starts at the person answering the phone or scheduling the appointment, right? And the other piece I'll say and then I'll shut up, I promise, is language matters, right? How people talk and the words people use are super important, right? I think that's something that I think we can do a better job in helping organizations like the VA and health systems from a training perspective to really bring them up to that cultural competence. So I think that's really a vital tool that we have that we can use immediately.
Thanks. Allison?
Not to be a Debbie Downer here, but I feel like one thing that's really hard to solve for, and this relates to, women as well, is the other patients. I can work on the culture of the VA employees all day long, but if the culture of the other patients is not accepting, or, and this is, it's very much generational, right? Like, I don't know how you solve for that. And I don't know
how are you solving for it in IAVA? How are you helping to make IAVA a welcoming veteran serving nonprofit?
Well, I'm a big fan of culture change starting from the top. So, one of the reasons why we totally went to bat for, Dennis McDonough got a lot of flack for putting pride flags out at the VA. But like that says in 0 words, you're welcome here, and he needs, like, there needs to be the battle royale where he sticks up for that and doesn't, have to back down, because that speaks volumes to the very people who need him to champion their cause, and to also, low key say that bullshit, that some of you are pulling inside our facilities is no longer acceptable here too. But I do think, the hard thing about culture change is that it takes time. I'm proud of the culture we built at IVA. We just had a member fly in, and we had 2 trans women as a part of our cohort that made it through the competitive process. And we didn't even find out until afterwards. But like, I'm proud to be running an organization where people do feel welcome to participate with us. But I just don't know that you can say that about the VA system fully right now too, which is tragic, actually, because the reality is about cultural competency is these veterans need cultural competency in being a vet as well, in addition to being a member of the LGBTQ community, right? Like, you need both, because we have a very unique lived experience.
Yeah.
And
Thanks.
before we move, I just wanted to highlight one thing, as we're talking about how do we create a space, and talking about VA. I can't speak for all of VA. If you know VA, one VA is one VA. But here in Oregon, I'm proud of our Portland VA system. I'm proud of our LGBTQ+ veteran care coordinators. But the reality is, in order for us to enact change, whether it be on a personal level, state, federal, all the way up, it's really going to take an opportunity for us to step into these spaces. And when we see something, we need to say something. I spend a lot of time going up to the VA hospital simply to go meet with patient advocacy, ensuring that if I do see something at the patient level, that it's addressed with the patient advocacy, and knowing that VA hospitals have a disruptive behavior committee in order for individuals to report this. And so it's important in our roles, even if we're going to the VA to seek our own care, if we see something, to report it, because the change will not come if we are also sitting in that silence.
Thank you so much, Ian. And I think that's a really important element to bring up. We've heard a little bit about the importance of language and symbolism from Eric and Allison. And then also, what you're talking about is that VA has actual policies in place that people who know about them can try to utilize to demand that folks are held accountable for their actions, and that VA abides by its own existing policies. And turning back a little bit to state level policies, Megan, we're seeing rapid evolution on LGBTQ+ policies at the state level. Can you maybe, I know this is a lot for a researcher, but can you hypothesize a bit about what outcomes may look like in the future in states where policies are becoming less supportive of LGBTQ+ equality?
Yeah. Basically, I guess what I'm worried most about is that we're going to move towards a world where all of these health outcomes and access outcomes are actually much more strongly associated with state policy context, and that where you live will really matter for LGBTQ+ vets, as well as trans kids, folks accessing reproductive health care, etc. States seem to be getting much more polarized and really bifurcating on some of these policy issues, which I think is going to lead to very divergent experiences in terms of social stress, discrimination, but also literally healthcare access.
Yeah. Well, on that topic, Eric, I wonder if you've heard from any of your clients that they are moving from one state to another because of some of these changing policies.
Yeah, absolutely, Kayla. And we've actually seen, I have personal friends that are moving from Florida, moving from Texas, and moving up to some of these safer states where there aren't these state policies, right? And the fact that they, the words they use, they feel like refugees leaving these states and picking up their entire lives and livelihood and their family, all their support structure, and getting out because they don't feel physically safe, right? The amount of harassment And what is that doing to them, just from a mental health perspective? We've seen it happen quite a bit, actually. We've seen people that are at the very least talking, if not actually leaving these states.
Wow. That is a really significant step with a lot of repercussions, as you mentioned, for support, and also, you know, financially, it is not cheap to pick up and move across the country. You know, we're talking about state level policies, at least to an extent here, but Allison, we've seen VA use federal supremacy to continue providing medically necessary abortion care to women veterans nationwide in the aftermath of Dobbs. Can you think of any national level LGBTQ plus focused policies that are priorities for IAVA right now?
Yes, we would like them to get their act together and offer gender affirming care, as Dennis McDonough said they would do. I think it might have been 2 years ago now, or coming up on it. You know, gender, first of all, is the largest healthcare system in the country. So the VA is in a position to get, you know, LGBTQ people in these states, period, access to care and like move the needle because it's a federal healthcare system. But it's also, you know, if we tell ourselves a story in this country that we're going to take the very best care of our veterans, like we're failing to hit the mark here. Like gender affirming care can be viewed in a lot of lenses depending on how you come at this, but people need to see it as life-saving care because it is. And the people who've sacrificed so much for our country should deserve to get life-saving care if they need it. And VA really needs to act. We're very frustrated with them not acting, but we're going to continue to beat the drum. We filed briefs in support of lawsuits to try and get this care, and we're going to keep at it. Hopefully, it's very important, in my view, to get it passed before the next presidential election. Because we don't know if the current administration, which is largely friendly to our community, will still be in charge anymore.
Thanks, Allison, for that important reminder. Ian, you talked a little bit about, you know, going directly into VA facilities and working with the LGBTQ plus VC veteran care coordinators. I try to not use too many acronyms, but I still slip in VA facilities in Oregon. But can you talk a little bit more about other ways that you may collaborate with your VA partners in Oregon and maybe even beyond if you ever go across state lines?
Do actually, this year is the first time I will be traveling in a couple weeks to Syracuse, New York for the Veteran Treatment Court Summit. And so I highlight that because I think collaboration inside the state at the local level, but also across states and at a federal level is absolutely the only way I can get this job done. So collaborating with VA facilities, again, is very paramount in the work that I do, but also in ensuring that LGBTQ plus veterans receive the care that they deserve. I maintain constant communication with VA leadership at the state level, so at our local levels, but also with VISN, and also working with the offices down at the central office in DC. And I do this because it's important to be able to address these unique needs of the LGBTQ plus veteran community, but also know where are the resources, where is the support for me in this role, but also for the community. I take ROIs on times for my veterans, my LGBTQ plus veterans in my casework, because at some point they may need assistance in advocating for that health care, or maybe advocating for a more LGBTQ plus friendly provider, because that does exist in the VA where individuals may not feel safe. And I also provide feedback to the VA. I facilitate dialogue between veterans and VA staff members at times in addressing concerns. I also, like you had mentioned, and I had mentioned prior, I work alongside our LGBTQ plus veteran coordinators in Portland, Roseburg, also in Washington State and Idaho, because some of our veterans in Eastern Oregon go to other VA facilities. I also work really close with our my counterpart, the LGBTQ plus veteran coordinator, Robin Lang, over at the Washington Department of Veterans Affairs. And so these types of collaborations together is, again, what ensures that I'm able to provide the best services and support that I can and that ODVA can for this community. I also have spearheaded initiatives like our LGBTQ plus veteran villages at our state pride festivals, so in Portland, Eugene, and now in Bend, Oregon. And this is an opportunity for our stakeholders from the VHA, so VA Health Administration, Veterans Benefit Administration, but also there's the specific programs within these agencies, such as the MST program, and bringing them all into one pride festival under one tent to stand in solidarity, to show the LGBTQ plus veteran community, their families, their friends, and even non-veteran LGBTQ plus folks that we here in the state of Oregon, we stand by this community. We are constantly and willing to advocate for stronger laws, policies, and again, it's just very important that these events, they offer visibility for a community that had been silenced for so long through policies like Don't Ask, Don't Tell. And I've told several colleagues that if we want to get in front of this, to include, when we talk about gender affirming procedures, I advocate for a push button discharge upgrade. Like, where is it? Individuals, we have individuals with DD-214s that are honorable, but still have homosexual narratives on them. And so, it's like by coming into these spaces, by collaborating across the state, but also throughout the state, it ensures that we are all saying the same thing, having conversations that are meaningful to the LGBTQ plus community. Last, before I go, is also I create presentations. Again, if it's powerful to educate, because some people just don't know. And what they don't know is what's going out there and providing care to our veterans. So by fostering collaboration, by raising awareness, again, over here at ODVA, we ensure that LGBTQ plus veterans in Oregon have the same equitable access to the resources, benefits, support that non-LGBTQ plus veterans do. And this ensures that we're not just surviving here in Oregon, we're thriving.
Thank you, Ian. We've gotten a lot of questions coming in already in the Q&A, and so I'm going to turn to that next. My last question that I was going to ask was about cultural competence, but it's already come up. Ian, you've mentioned that you give some training on that. Eric, you talked about the importance of that, and also I think, Ian, one of the important things you raised is the importance of just learning the history and learning the stories and immersing yourselves in people's lived experiences is a great way to help develop some of that cultural competence. Megan, I'm going to give you a super quick and easy question first, and then we'll dig into some harder, meatier ones that may be more conversational. The quick one is, can you define uninsurance from your work, and does it include underinsurance?
Yeah, so on the Burfus survey, it's simply, do you not have any insurance? So it doesn't include underinsurance.
Okay, thank you so much. So another one that I want to turn to first, because I think it's a really interesting one, is from somebody who's training to be a chaplain at VA and wants to hear about this kind of tension that's come up in the harm that some have experienced at the hands of the military system, while still maintaining like a love of country and other veterans and ongoing desire to serve. How can others in the spiritual community or veteran serving nonprofits or beyond help navigate that tension, and how can folks support people who are maybe, wrestling with a complex interplay of factors? I don't know if maybe Eric, I'll ask you to try to tackle that one first, put you on the spot, and then we'll come to Allison.
I think let's let Allison go first, because that's okay. A tough one. That's a tough for sure.
Yeah, I would just go back to my point earlier. I really do just think this is an individual by individual experience. I'll tell you, I have a friend who's still and she's like way gayer than me, like in the sense that you can like tell, she was in Don't Ask, Don't Tell, is now married, lives in a state like New York where she has a lot of benefits, but she's still in the Army Reserves because the Army was a place that also felt like she could be validated and like earn respect and accepted outside of otherwise feeling rejected for her sexuality. Does that make sense? And so whereas some people really resent the military and its policies, like she's still in because it gives her a sense of belonging that she lost because she's the type of LGBTQ person whose family turned their backs on her. And so I think encouraging you to not make any assumptions about one individual veteran's, experience as also, a member of the LGBTQ community, and just be open to hearing from them how they can be best supported. And I know it's an overused phrase, but if you learn to meet people where they're at as a chaplain in a lot of different contexts, it can be done with us too. We're no different,
Thank you.
Makes a lot of
Eric?
sense. I would just, to piggyback on that, I think it's very important, to Allison's point, every person's journey is different. And listen, as a gay veteran, I've had that conflict quite a bit, right? From how do you navigate, hey, I'm supposed to be serving my country, but my country doesn't really care about me. And hey, when I go to the VA, or when my friends go to the VA and get harassed, right? Or any health system and get harassed, right? How does that make them feel? So it's a difficult thing. I think really going through those multiple identities and trying to really work through kind of a lot of us have multiple identities, right? I'm a gay man, I'm a veteran, I work in mental health, like that there are so many different aspects. I think really helping people navigate, and to Allison's point of meeting them where they're at is really important, and really just listening, right? There's a certain point where you don't have to be prescriptive, right? Listening to folks, I think, goes a long way in listening to their experience and the path that they took, really.
Thank you. And I've also seen some folks dropping into the chat some really, I think, thoughtful suggestions on language and ways to phrase things that can be really helpful, and the importance of creating spaces where people feel safe. We had another question in the Q&A about folks with less than honorable discharges, and I think Ian addressed that at least to an extent by talking about supporting people in navigating the process. You mentioned acronym that not everyone may know, which is the BCMR, the Board for Correctional Military Records. And there are multiple different military review boards. It can be a tough process. People may need the support of an expert like Ian to navigate that process, or even may want to seek pro bono legal support in trying to navigate that type of process. But there's another challenge that came up in a second question here about how, even if you are able to navigate that process, if you were kicked out because of don't ask, don't tell without meeting a length of service requirement, getting that updated DD-214 may not change your eligibility for benefits. So what, if anything, is being done to address that? Are any of you aware of efforts to get that changed, either legislatively or through policy?
I think I want to hop in on this one. Wow, what a complex issue, right? And I don't think there is a finite answer here. So I can only just tell you what I do with my clients. Initially put them through and identify, if we're going to file for a discharge upgrade, I want to see, is there VA service connected disability benefits available? Because again, that 2-year bar, that's where, again, with the veteran I mentioned earlier, after they had passed, they got a discharge upgrade and then were denied burial benefits. And so I worked closely with the veteran's mother, who is just a wonderful ally and advocate, in petitioning, working with our senators, petitioning the Undersecretary of VA for a waiver, while also petitioning the BCMR for accredited 2-year active duty. This has happened in the past. And so when I package my discharge upgrades, I'm going to go ahead. I always ask for accredited active duty time, knowing that the chances of getting that are slim to none. But I also go ahead and say, if you're not going to give us this, will you consider this DD-214 and service to be completion of required active service? It's those two statements that are going to dictate whether a veteran can access those benefits. but I also like to make sure that I'm doing the best I can on a discharge upgrade. So getting a character of service determination from VA is a really powerful letter to attach with that DD 149. I don't know if I answered that question, but I told you my process.
I think it is helpful, and one of the things that to me it points out is how this can be really complex, and for many people, you know, it may take more than just trying to figure out the paperwork yourself.
Yes, and you know,
Working
I
with
say this
yourself.
here in the state of Oregon, if you're a veteran service officer, you're qualified to file for a discharge upgrade. And it's sad that we've allowed the rhetoric to continue that you need an attorney. That right there is a barrier for individuals to even access this idea. So veteran service officers, if you can build a claim for a VA benefit, you can build a claim for a discharge upgrade.
Right. And they can reach out to colleagues like you to help understand those important, like, terminology, like what is most important to get in there, and what can be supportive in navigating that. So I
Absolutely,
think
absolutely.
that's helpful to know. The next question, Allison, I think I'm going to turn back to you to see if this is something that IV has tackled yet, or if it's on your radar, which is, the question is, what, if any, organizations are advocating for culture change regarding LGBTQ plus issues more broadly within VA, not just veteran facing, but also employee facing, that when going on to VA as a new employee, the elements of sexual orientation and gender identity were kind of skipped over in the onboarding brief, and even within the ERG, lack of the VA employee resource group for LGBTQ plus veterans, employees, lack of adequate support for trans veterans within the group. So, you know, I think we tend to think a lot about the the veteran facing side, but as we've talked about, like, culture change is bigger than that. So is anybody also, you know, thinking about this from the employee facing angle?
I am. In our organization is like, if I had to suspect, I would, and this is just me speculating, but I am curious if there is internal institutional resistance to the rule on gender affirming care. You know, the VA's got old employees who've been there a long time, and many of the employees are, you know, unfortunately, it's a bureaucracy. Kayla, you know this better than I do, that there are some people who can really get in the way of good policy change because they've learned how to just be like a bureaucratic block. And the only way I know how to continue to help the VA evolve is by running a good outside game and continuing to push them from the outside to get with the program, and to call bullshit when we see it, and to make sure that at least somebody's getting the backs of LGBTQ veterans. And it's just a shame, and I've said this about our advocacy around women, it's like the very institution that's supposed to be designed to support us, you know, is inadequately doing so, right? It's like, just, it's screwed up at the end of the day. And like, as a nation, I think we also have implications if we don't address whether it's, you know, culture change, because if you don't have a good culture there, then it doesn't matter if you have world-class healthcare, nobody's going to want to go access it. But I also think, like, if we don't really wrestle with this, like, we have a military recruiting crisis going on in the background, and how we care for our veterans tells the next person who's going to raise their hand and sign up to serve, how they're going to be cared for. And if, you know, just because Don't Ask, Don't Tell was repealed in the military and the military is coming along, if they still are going to get slapped in the face by the time they try to go to the VA, or make somebody uncomfortable when they're trying to get freaking health care, then we've got a problem, I think. And I think as a nation, we need to work together to address this holistically, because I actually think it has national security implications at the end of the day. Anyway, I don't know if I answered the question, but that's my meta sort of view.
Thank you. That's a great place, and good timing, because we are almost precisely at time, and I have just enough time to thank all of the audience for joining us today on this webinar. I hope all of you in the audience will join me in extending appreciation to our wonderful panelists for the engaging and informative discussion. Thank Megan for presenting a sneak peek of the findings, and thanks to Rajiv and VPRI for hosting this event. You know, if you enjoyed this event, you want to get updates about future events like this, make sure you get an email notification when the report that Megan previewed is formally released. Please go to the RAND Veterans Policy Research Institute website and scroll down to the bottom and add your email to the Stay Informed box. I just dropped the link in the chat box as well. That way we can stay in touch with you. Again, thanks so much to all of our wonderful panelists today. I really enjoyed this rich and thoughtful discussion, very provocative, but with some great tips of where we can go to push for change and get support while we're doing it. Thanks so much, everyone.
Thanks for having us.